151. Albuterol is a long-acting beta agonist used for maintenance therapy in asthma. True or false? Answer: false. Rationale: albuterol is a short-acting beta agonist, SABA, used for quick relief in asthma attacks, not maintenance. 152. Amiodarone is commonly used to treat ventricular arrhythmias. True or false? Answer: true. Rationale: amiodarone is an antiarrhythmic drug effective against life-threatening ventricular arrhythmias. 153. Methotrexate is a chemotherapeutic agent and immunosuppressant. True or false? Answer: true. Rationale: methotrexate is used in cancer and autoimmune disorders like rheumatoid arthritis due to its immunosuppressive effects. 154. Hydrochlorothiazide increases potassium levels. True or false? Answer: false. Rationale: thiazide diuretics like hydrochlorothiazide can cause potassium loss, leading to hypokalemia. 155. Rifampin may cause red-orange discoloration of body fluids. True or false? Answer: true. Rationale: rifampin, used in tuberculosis treatment, often causes harmless discoloration of urine, tears, and sweat. 156. Atenolol is contraindicated in patients with bradycardia. True or false? Answer: true. Rationale: as a beta blocker, atenolol reduces heart rate and should not be given to bradycardic patients. 157. Naloxone can reverse the effects of benzodiazepines. True or false? Answer: false. Rationale: naloxone is used for opioid reversal. Benzodiazepine overdose is reversed with flumazenol. 158. Atropine is used to treat symptomatic bradycardia. True or false? Answer: true. Rationale: atropine increases heart rate by blocking parasympathetic input, making it effective for symptomatic bradycardia. 159. Propofol is a long-acting sedative hypnotic used for chronic insomnia. True or false? Answer: false. Rationale: propofol is an ultra-short-acting anesthetic used for induction and maintenance of anesthesia, not for insomnia. 160. Buspirone is effective for immediate relief of anxiety symptoms. True or false? Answer: false. Rationale: buspirone has a delayed onset and is used for long-term management of anxiety, not for acute relief. 161. Ciprofloxacin belongs to the fluoroquinolone class of antibiotics. True or false? Answer: true. Rationale: ciprofloxacin is a fluoroquinolone effective against a wide range of bacterial infections. 162. Antacids should be taken at the same time as other oral medications. True or false? Answer: false. Rationale: antacids can interfere with the absorption of many oral drugs and should be spaced by at least 1 to 2 hours. 163. Bupropion is associated with increased seizure risk, especially in high doses. True or false? Answer: true. Rationale: bupropion lowers the seizure threshold, especially when dosed above recommended limits. 164. Lidocaine can be used as both a local anesthetic and antiarrhythmic agent. True or false? Answer: true. Rationale: lidocaine is used locally for anesthesia and intravenously for ventricular arrhythmias. 165. Carbamazepine is safe for use during pregnancy. True or false? Answer: false. Rationale: carbamazepine is teratogenic and associated with neural tube defects. Caution is required during pregnancy. 166. Spironolactone is a potassium-sparing diuretic. True or false? Answer: true. Rationale: spironolactone inhibits aldosterone, promoting sodium excretion while retaining potassium. 167. Simvastatin is most effective when taken in the morning. True or false? Answer: false. Rationale: simvastatin is typically taken in the evening when cholesterol synthesis is highest during sleep. 168. Gabapentin is commonly used to treat neuropathic pain. True or false? Answer: true. Rationale: gabapentin is an anticonvulsant also effective in treating nerve-related pain conditions. 169. Acetylsalicylic acid, aspirin, should be avoided in children with viral infections. True or false? Answer: true. Rationale: aspirin in children with viral illness is linked to Reye's syndrome, a potentially fatal condition. 170. Diazepam has a short half-life and is used for daily anxiety control. True or false? Answer: false. Rationale: diazepam has a long half-life and is more suited for acute anxiety or procedural sedation, not daily long-term use. 171. Phenazopyridine treats urinary tract infection by killing bacteria. True or false? Answer: false. Rationale: phenazopyridine is a urinary analgesic, not an antibiotic. It relieves discomfort, but does not treat the infection. 172. Ketorolac should not be used for more than 5 days due to risk of GI and renal toxicity. True or false? Answer: true. Rationale: prolonged use of ketorolac increases the risk of serious side effects including gastrointestinal bleeding and kidney damage. 173. Levodopa must be taken with high-protein meals for maximum absorption. True or false? Answer: false. Rationale: high-protein foods compete with levodopa for absorption and can reduce its effectiveness. 174. Lactulose helps lower ammonia levels in hepatic encephalopathy. True or false? Answer: true. Rationale: lactulose promotes ammonia excretion in the colon, making it useful in treating hepatic encephalopathy. 175. Sucralfate forms a protective barrier over ulcers in the stomach. True or false? Answer: true. Rationale: sucralfate adheres to ulcer sites and protects them from acid, promoting healing. 176. Morphine can cause respiratory depression as a serious side effect. True or false? Answer: true. Rationale: as an opioid, morphine can suppress respiratory drive, especially in high doses or with other sedatives. 177. Allopurinol is used for acute gout attacks. True or false? Answer: false. Rationale: allopurinol is used for long-term management of gout by reducing uric acid levels, not for acute attacks. 178. Chlorpromazine is a first-generation antipsychotic. True or false? Answer: true. Rationale: chlorpromazine is a typical antipsychotic that works by blocking dopamine receptors. 179. Neostigmine is used in the treatment of myasthenia gravis. True or false? Answer: true. Rationale: neostigmine increases acetylcholine levels, improving muscle strength in patients with myasthenia gravis. 180. Propranolol is a selective beta-1 blocker. True or false? Answer: false. Rationale: propranolol is a non-selective beta blocker, affecting both beta-1 and beta-2 receptors. 181. Metformin can cause lactic acidosis in patients with renal impairment. True or false? Answer: true. Rationale: metformin is contraindicated in patients with significant renal impairment due to the risk of lactic acidosis, a rare but serious side effect. 182. Clopidogrel is an anticoagulant that directly inhibits thrombin. True or false? Answer: false. Rationale: clopidogrel is an antiplatelet agent that inhibits ADP-mediated platelet aggregation, not a direct thrombin inhibitor. 183. Nifedipine is a calcium channel blocker used to manage hypertension and angina. True or false? Answer: true. Rationale: nifedipine relaxes vascular smooth muscle, lowering blood pressure and relieving anginal symptoms. 184. Warfarin therapy requires monitoring of INR levels. True or false? Answer: true. Rationale: warfarin affects vitamin K-dependent clotting factors and requires INR monitoring to maintain therapeutic range and prevent bleeding. 185. Enoxaparin is given orally for DVT prophylaxis. True or false? Answer: false. Rationale: enoxaparin is a low molecular weight heparin administered subcutaneously, not orally. 186. Omeprazole is a proton pump inhibitor that reduces stomach acid production. True or false? Answer: true. Rationale: Omeprazole blocks gastric H+/K+ ADPase pumps, reducing acid secretion and treating GERD and ulcers. 187. Digoxin is contraindicated in patients with hypokalemia. True or false? Answer: true. Rationale: hypokalemia increases the risk of digoxin toxicity, which can cause dangerous arrhythmias. 188. Vancomycin should be infused rapidly to achieve therapeutic levels quickly. True or false? Answer: false. Rationale: rapid infusion of vancomycin can cause red man syndrome, so it should be infused slowly over at least 60 minutes. 189. Tetracyclines should not be taken with milk or antacids. True or false? Answer: true. Rationale: calcium and antacids can bind tetracyclines and reduce their absorption and efficacy. 190. Phenytoin can cause gingival hyperplasia with long-term use. True or false? Answer: true. Rationale: a common side effect of chronic phenytoin therapy is gingival overgrowth, requiring good oral hygiene. 191. Furosemide can cause ototoxicity, especially when administered rapidly. True or false? Answer: true. Rationale: high doses or rapid for administration of furosemide can cause reversible or irreversible hearing loss. 192. Insulin glargine has a peak action 2 hours after administration. True or false? Answer: false. Rationale: insulin glargine is a long-acting insulin with no pronounced peak. It provides steady levels over 24 hours. 193. Lithium toxicity is more likely in patients with low sodium levels. True or false? Answer: true. Rationale: hyponatremia leads to increased lithium reabsorption in the kidneys, increasing toxicity risk. 194. Nitroglycerin patches can be left on continuously for 24 hours. True or false? Answer: false. Rationale: continuous exposure leads to tolerance. Patches should be removed for 10 to 12 hours daily. 195. SSRIs increase serotonin levels in the synaptic cleft. True or false? Answer: true. Rationale: SSRIs block serotonin reuptake, enhancing its availability and improving mood and depression. 196. Beta blockers may mask symptoms of hypoglycemia in diabetic patients. True or false? Answer: true. Rationale: beta blockers can blunt signs of hypoglycemia like tachycardia and tremors, posing a risk in diabetes. 197. Acetaminophen overdose can cause hepatotoxicity. True or false? Answer: true. Rationale: high doses of acetaminophen overwhelm liver detoxification pathways, leading to liver damage. 198. Diltiazem is used to treat hypertension and atrial fibrillation. True or false? Answer: true. Rationale: diltiazem is a calcium channel blocker that lowers blood pressure and slows heart rate, useful in atrial fibrillation. 199. Fluoxetine is an SSRI that may take several weeks to reach full therapeutic effect. True or false? Answer: true. Rationale: like most antidepressants, fluoxetine may take 4 to 6 weeks to achieve full benefits. 200. Prednisone must be stopped abruptly after long-term use. True or false? Answer: false. Rationale: abrupt cessation of prednisone after prolonged use can lead to adrenal insufficiency. Tapering is required.